P2 comes earlier. It's a similar mechanism. I can say because लेफ्ट वेंट्रल ब्रांच ब्लॉक में क्या होगा, लेफ्ट वेंट्रिकल को इलेक्ट्रिकल इम्पल्स जल्दी नहीं मिलेगा, लेफ्ट वेंट्रिकल जल्दी कॉन्ट्रैक्ट नहीं होगा, अगर जल्दी कॉन्ट्रैक्ट नहीं होगा तो जल्दी रिलैक्स भी नहीं होगा, बिकॉज ड्यूरिंग द रिलैक्सेशन ऑफ द लेफ्ट वेंट्रिकल द एओर्टिक वॉल इज गोइंग टू क्लोज. That is the reason we get a delayed A2. Delayed A2 in case of left bundle branch block. Now see, let me analyze it pictorially again. This is the left ventricle, this is aorta. We are trying to analyze why exactly left bundle branch block produces delayed A2. Remember, A2 is the aortic wall closure. When you understand the mechanics behind it, you understand the other things also which are related to that. That is the reason these things are important. So delayed A2 in case of left bundle branch block. What is left bundle branch block? Bundle of is left bundle branch, right bundle branch. This is blocked. So impulse is going to go late to the left ventricle. So left ventricle is going to contract late. Left ventricle is going to contract late. If the left ventricle is going to contract late, it is going to push the blood through the aorta late. If it is going to push the blood through aorta late, aortic wall is going to open late, aortic wall is going to close late, and that produces delayed A2 component. That produces delayed A2 component. Okay, so we were trying to analyze, I'm sorry again this was a disconnection, in the abnormalities of the second heart sound. So we were talking about the delayed A2. Delayed A2. Now what exactly is going to produce delay in the A2 component? Delay in the A2 component is aortic wall producing a delay. Yes. So here we were, let's say for example, this is what is the heart, this is what is the left ventricle, this is what is the aorta coming out from the left ventricle, and we are trying to analyze this particular point. Why exactly complete left bundle branch block produces delay in the A2 component? So left bundle branch block is the block in the current getting conducted to the left ventricle. So when the current getting conducted to the left ventricle late, left ventricle is going to contract late. If it is going to contract late, it is going to push the blood through the aorta late. If it is going to push the blood through the aorta late, aortic wall is going to remain open for longer time compared to pulmonary wall. So it is also going to close late. That is the reason we get delay in the A2. So if you can see that there is a split in the second heart sound, there is a possibility that there can be a complete bundle branch block, which can be confirmed with an ECG, of course. Or conversely also you can do. If you can find the complete left bundle branch block in the ECG, try to auscultate S2. If it is a split, then you can understand that your clinicals are working good. You are able to analyze things properly. Left ventricular outflow tract obstruction, same thing. Aortic stenosis, let's say for example. Left ventricle का outflow tract is what? Aorta. Aorta is going to push the blood through the left ventricle. Aorta is going to push the blood through left ventricle. So that is the reason we can understand that complete left bundle branch block, left ventricular outflow tract obstructions, athero or arteriosclerotic heart disease, Eisenmenger's complex, Eisenmenger syndrome or Eisenmenger complex is the cyanotic heart, acyanotic heart disease converting into cyanotic heart disease. Of course, I won't go into the details about it. हम लोग जब भी congenital heart disease लेंगे तभी अपने को पता चलेगा ये. So all these things are going to produce delay in the A2. Delay in the A2 is aortic valve closing late, because closure of the aortic valve is going to produce A2 sound. A2 sound. Similarly, delay in the P2, WPW syndrome, all the similar problems which are related to pulmonary valve. Similar problems related to pulmonary valve. In some situation, ये समझा एक बार, अनम्यूट करो. थोड़ा सा बीच में डिस्कनेक्शन हो गया था, बट इट वॉज, आई रिपीटेड इट अगेन. ठीक है. So we may also get a single S2, maybe because of aortic component or pulmonary component is missing.